Next speaker is Bruno Sarmento, PI at the University of Porto, and he's going to present on the modulation of pharmacokinetics of dual targeting nanomedicine for the penetration to the blood-brain barrier.
Yes, okay, thank you. So, good afternoon to all the resistants to stay here until so late. Actually, today I'm going to talk a little bit about the brain delivery and tell you a very concrete story of the work that you have been developing in the lab and on the formulation that we believe that is with high potential in terms of crossing the BBB. But before that, okay, just to focus a little bit about what's the importance of the brain diseases and diseases that are related with the brain and central nervous system. Just to give you some numbers, around 1/3 of the diseases worldwide are related with the brain. And this is particularly dramatic because the incidence is increasing, but the therapeutic approaches to treat these diseases is not increasing the same trend. So we need to do something around, most probably about the delivery issue rather than the molecules that you have available for treat these diseases. And one of the main reasons why it's so complicated to treat diseases in the brain is because of the BBB, of course. I'm sure that all of you are aware about the complexity of the BBB and why BBB so dramatically decreased the permeation of the drugs, because it was conceived by Mother Nature to protect our brain. So it's obvious that we have to take advantage of the positive role of BBB, but on the other hand, drugs need to cross it. And I'm going to focus particularly on the brain cancer and glioblastoma today. That is one of the most deadliest tumors that we have all around. And this glioblastoma is quite complicated to treat, not only because of the BBB itself, but also because of the high degree of heterogeneity of the tumor, how this tumor is also related with cell migration and plasticity, and this complicate that much the treatment approaches. And for a long time, we know that almost for more than 40 years, that we have therapies to treat these patients, but the therapies actually are not completely efficient. And the standard of care on the TMZ is probably the best approach that we have, but we still have an issue related with DBZ, is that the efficacy is associated with a high dose. So in our idea, we could take advantage of molecules with higher potency as docetaxel. But on the other hand, these molecules have pharmacokinetic issues that needs to be solved. So we propose nanomedicine, a polymeric nanomedicine that was made of a core of PLGA, so a polyester, well-known material that is surface pegylated in order to have long time circulation and also for targeting ability. So our idea was to have a dual target in order to make these particles go actively into the cancer cells in a second stage, but first they need to cross the BBB. So for that, we use histidine ligand anchored to the particle in order to target these nanoparticles to the LAT1 receptor. We know that is overexpressed in many glioma cells, especially in late glioblastoma. So this was the second targeting ability. But then, but before that, we need to have a strategy to overcome the BBB. So we also use a ligand, the peptide that is also quite known in terms of being taken up by LDL receptors, overexpressed in endothelial cells. But the novelty here was to associate the targeting ability to acid cleavage property of the particle. So what we want to do, we want to target the particle to the endothelial cells. We want to promote the transcytosis process, but during the transcytosis, the the dense pegylation should be cleavage in order to allow the second histidine ligand to interact quite nicely with the cancer cells. And on the other hand, not to be retained in the between the endothelial cells, because it's one of the reasons why we have so high drug resistance against the brain targeting. So this was the concept. So we start by producing these materials. So we did the pre-functionalization of the particles in order to be easier to functionalize, easier to characterize, and also easier to produce. So long story short, we confirmed that the short PLGA peg was successfully bound to the histidine, and the longer PLGA peg was successfully bound to the angiopept. And then we use a very well-established microfluidic approach by nanoprecipitation. This was a method that we developed in the group a few years ago in order to have an adaptation of the nanoprecipitation, and we have a full automatic and autonomous method to produce these particles in a large scale. So first we want to assess whether or not the particles have targeting ability for the tumor. So looking on the first ligand, on the histidine one, so we assess interaction studies between the particles and primary cells of glioblastoma. So we collect different cells from different patients, and we observe the same trend independently on the cell. We know that we have a lot of heterogeneity on the tumor, so that's why we perform this study in different primary cells. But overall, we saw a clear tendency in terms of increasing the density of the functionalization of the surface with histidine and the increase of internalization of the particles by these cells. And we just take this gene 31 example. So definitely particles were taken up, but we also observe a clear distribution of these particles throughout these cells. This was just a 2D study, so it's not completely relevant. It gave some indication that the strategy was working. But then we established also a multi-compartmental spheroid model comprising by cancer cells, endothelial cells, and monocytes. And after validate these spheroids regarding cell position and cell density and so on, so we look into the localization of the particles in the spheroid. And once more, there's a very positive trend comparing non-functionalized to functionalized particles, so they were retained inside the spheroid itself. And looking at the efficacy, when we assessed the metabolic activity of the cells, we saw a very clear tendency of the functionalized nanoparticles to originate higher cell death, or at least decrease the cell viability. This was also interesting to see that the effect that we observed was even higher for the free drug, and this was made in a static model. But we believe that the fact that we have a sustained release of the drug can also help in prolong the effect of the drug when it is in the tumor microenvironment. So then we did some intratumor pharmacokinetics first. We are still just with monofunctionalized particles. So we did this orthotopic model. We inject the cells, and we look at the efficacy of the treatment, comparing the non-functionalized nanoparticles and the free drug. Okay, the effect was not, I would say, not very enthusiastic, but we saw that compared to the free drug, the particles that were functionalized result in an increase of median survival of these animals for a significant number of the animals. So we have here an indication that if by chance we could cross the BBB, eventually the particles that cross the BBB could be more active compared to the free drug. So that's what we did afterwards. So we validate not only the acidic cleavage properties of the particles, but also the passage of the particles through the blood-brain barrier. So for this, we established a transvaal-based model, comprised these primary endothelial cells for the microvasculature of the brain, and we quantify the cell density in terms of the passage. So what you see here is the particles that are modify with the angiopept in an acidic cleavage manner and without the properties of the cleavage. So when we remove the cleavage properties, because we have a PLGA peg without the acetal group, there's no difference between the functionalized and non-functionalized particles. But we have a clear increase when the particles were functionalized with angiopept on there. We also perform competitive studies, I'm not here, but again, we demonstrate that the transcytosis process was due to the targeting of the angiopept to the LDL receptor. Okay, so then we went for the first pharmacokinetic studies. So we did it by IV. So we just heard that it's not the perfect technique, we agree, but it gives some preliminary data about the position of the particles in the brain. And again, so when we administered the particles intravenously, they were located in the brain with a 3 to 4-fold increase compared to the non-functionalized nanoparticles for the very preliminary pharmacokinetic study. And then we look at the efficacy as well. So we use the same orthotopic model, we inject the cells on the animal, and we track these animals up to 2 months, looking mostly at the survival rate of these animals. We also look at the tumor at the end, the tumor size at the end. But again, what we saw is an indication that the dual functionalization of the particles was responsible for a significant increase of the median survival of these animals. Of course, in terms of the survival after 2 months, we decided to have these 2 months as endpoint due to the logistical issues, but we have conditions to prolong a little bit more this trial. But what we came from this pharmacokinetic data is that non-functionalized particles were not that important compared to the free drug, but when we have the dual functionalization, definitely we have a trend. It's not still probably the ideal. We need to optimize it a little bit more in terms of cell density, in terms of density of the functionalization, but the data were quite promising. What is very promising, and actually very clear, is in terms of the safety. When you look at the safety profile of these animals that were treated with different formulations, we didn't observe any difference between controls and particles that were functionalized or non-functionalized. We look at different biomarkers. We did, of course, histology in terms of different tissues. And this is, of course, very important because safety is one of the main parameters to allow us to prolong the pharmacokinetic studies for more than 2 months, and that's actually what we are doing. So very briefly, I hope that I have convinced you that brain diseases are a very important issue, especially those with tumor origin. And nanomedicines can, of course, overcome poor pharmacokinetic properties of wonderful drugs that you have in the market. And in that case, we use a dual targeting approach, not only to target the barrier itself, and we demonstrate that it's possible to overcome the BBB, but at the same time to target the cancer cells after this complex the particles when the particle is crossing the barrier. So thank you very much for your attention, and we'll have discussion at the end.